So today we're going to be talking about golfer's elbow or medial epicondylitis. And we're going to be treating it with this massage scraper tool by Dr. B Fit. So golfer's elbow is going to be your medial epicondyle, which is right here. It's this bony prominence on the inside of your arm. A lot of the wrist flexors are going to be attaching to this point right here. And especially when it comes to throwing, when it comes to motions that you're extending out or with your golf swing, this can become really sensitive. Now, when it comes to medial epicondylitis, it usually happens over time from a lot of repetitive injuries. So plumbers can get this, construction workers can get this, golfers can obviously get this, or people that are throwing, pitching. So there's a lot of muscles that attach to this main tendon right here. And when we start to get that, it's really the tendon and the bone that is getting inflamed. Now we got a golf shoot. So with medial epicondylitis, or golfer's elbow, we want to address the muscles in the tendon that attach right to this bony prominence. So when you guys start to feel it, that's going to be the first phase, which is the inflammatory phase. It's going to be the most painful, the most heightened. We want to do some soft massage. You can either do it with your hand. I like to use a tool. I like to do a little bit of some scraping. You can scrape towards it to get the blood flow going back to your heart, but it's good to just kind of needle it back and forth. You can do some light massage work, back and forth. But the real trick is when it starts to go into the secondary phase, which is going to be more of the mobility and stretching phase. So when that happens, there's muscle fibers are going to exist in every single muscle. Obviously, there's thousands of muscle fibers. And you have sarcomeres and sarcolemmas that contract when your muscle contracts and relax. But what happens over time, especially when there's inflammation and the muscle gets knotted, those sarcomeres and sarcolemmas do not release. That creates a knot in the muscle fiber. And it's important that we start to work that out. So you can work that out through massage, but it's also important to start to stretch. So I'm gonna give you a quick stretching technique to start stretching these muscles to be able to start to relieve that pain. All right, so for the stretch, we're gonna extend the arm. We're gonna put palm down. Now, if you start to feel it here, I want you to go just as far as you start to feel it. I know this is going to be painful for you, so I want you to increase from your resting pain level by 2 pain points. That means at rest, right here, if it's at a 3, you're going to go until it's about a perceived 5. Now, if you don't feel it here, that's okay. Lean into it. If you still don't feel it, I want you to slowly start to turn your hand until you start to feel it. And if you really don't feel it, turn it all the way around, start to come back. I mean, you're definitely going to feel it there. I don't hurt right now, and I can definitely feel that stretch. So you're gonna do that stretch nice and easy. We don't want to overexert. If the pain starts to creep up from a 2 pain point from resting, I want you to stop, back off, relax, let it calm back down, and then go back into your stretch. Try to do accumulation of at least 4 minutes if you're over the age of 40. You can do it for 60 seconds if you're under the age of 40 to get a nice soft tissue change in the muscle fibers. Thanks for watching, guys. Hope you learned a little bit about golfer's elbow and medial epicondylitis. Please like and subscribe so you guys continue to learn, improve, and perform better.